Hello out there, home care heroes. This is Lucas Carroll, the founder of the Business of Senior Care. Thanks for joining in today. Today I have an interesting topic to talk about, and that is a couple of government payers to try and break down what they provide and what services are available, and those are Medicare and Medicaid. Now, when I first got into the healthcare industry, first, I thought they were the same thing, and maybe that the names could be used interchangeably between Medicare and Medicaid. And then I didn't understand the difference between the two, and I thought maybe they provided similar services. And there was a whole lot of confusion for me in understanding these two programs. And so the purpose of this video is to talk about these two programs and how they benefit non-medical home care agencies, home health, and hospice agencies, which are our primary clients that we help support for startups and existing businesses around the country. We'll start with Medicare. Medicare is a program. They're both federal programs, and they are operated out of CMS, which is the Center for Medicare and Medicaid Services. So they're both run out of Washington, D.C. They're both in the healthcare space. They're both were created to provide and cover care and services for citizens of the United States to help them with their health and wellness. But they have their different programs and they have different targets in terms of who they help. So for Medicare, this program is developed and targets for seniors, for individuals who are 65 years of age or older, and helps to cover certain health benefits. Now, there are people besides 65 years of age and older that can qualify for Medicare. People that are on disability, people that have like end-stage renal disease, and other specific target groups can qualify for Medicare benefits, but the primary beneficiary are individuals 65 years of age and older. So the way that you become eligible is you turn 65 years of age or older, and then you can enroll in a number of different program offerings under the Medicare umbrella. They cover anything from a hospital stay to a primary care visit to items that we are concerned about, which is home health visits, home hospice visits, things like that. So in the Medicare space, primarily for our service offering, which are home health and hospice, Medicare is a huge player for reimbursement for agencies that we support. It often can be the best payer or one of the best payers when you're thinking about bringing on particular patients and different payer mix for helping to support your agency. So primarily for home health and for hospice, getting contracted with Medicare is an important component, and can be a fairly lengthy process to get contracted. And in both situations, for both skilled home health and hospice, there's a previous step called accreditation that's required before an agency can contract with Medicare. And accreditation is different between home health and hospice, but it requires signing an agreement with an accreditation organization, which would be Joint Commission, CHAP, or ACHC, and then taking on a number of patients to provide care to them, having an accreditation survey, becoming accredited, and then being able to move forward and finalize Medicare contracting. So because these are targeted for healthcare or skilled health agencies, they primarily focus on home health and hospice. Now, it is interesting to note that there are some new programs under the Medicare umbrella that have targeted non-medical home care. Now, non-medical home care is a force to be reckoned with. The demand continues to increase each year for care and services for non-medical home care. And because of the explosion of the need of this type of care, which is traditionally paid for by private pay, Medicaid, and veteran services, along with insurances like Medicare Advantage and long-term care insurance. Traditional Medicare has historically stayed out of the space for reimbursement for non-medical home care. Well, there are programs like the Medicare Guide program that are relatively newer that do make their way into non-medical home care. And how a program like Medicare Guide works is that Seniors who have a dementia diagnosis who are enrolled in traditional Medicare are eligible for respite hours from Medicare, a certain number of hours per year they can provide receive non-medical home care services under that specific program. So the way it works is intermediary organizations in the local community contract with Medicare, and then those intermediary organizations then turn around and contract with home care agencies. And the contract includes negotiation of the rates and those types of things between the intermediary organization and the home care company. And then that home care agency can then provide those services and be reimbursed by the intermediary organization, who is then reimbursed by Medicare. So that's an example of a program for home care agencies. And there will undoubtedly be programs in the future where Medicare is directly or indirectly covering non-medical home care services like companionship, homemaker, and hands-on personal care to be able to handle the significant increased need in home care services for the senior population. So traditionally, Medicare works with home health agencies, hospice agencies, and they provide reimbursement for skilled medical services. Skilled medical services are things like IVs, insulin injections, physical therapy, occupational therapy, speech therapy. They are for home health agencies and hospice, which we'll talk about, but for home health, they are targeted for improving the functionality of a patient. So a patient gets discharged from the hospital, then they receive care from a home health agency. They create a baseline for where the individual patient is at, and the goal is to functionally improve over time following the physician's order, 1 to 2 weeks, 4 to 6 weeks, whatever the physician's order says, and then continue to monitor and track an increase in the functional ability. So whether it be recovering with medication management, IVs, or functional physical improvement through physical therapy and occupational therapy, home health is measured in terms of how they are improving the functionality of an individual. On the hospice side, the goal of hospice is to provide comfort and care during the anticipated last 6 months of someone's life, and to provide medication management and care and services between like a nurse, a chaplain, a social worker, a CNA, to help provide support services for an individual who is in the dying stage. So the goal of that one's a little bit different, and so Medicare tracks the progress for that differently, but then they reimburse the agency for providing those care and services. So Medicare traditionally focused on medical services that take place in the home. That's what we're talking about for our seniors, 65 years of age and older. Now, Medicaid is a separate program still under the umbrella of CMS out of Washington, but where Medicare is managed federally. All the claims go to Washington, all the application packets go to Washington. Medicaid, on the alternative, is managed on the state level. So CMS has decided that Medicaid can be managed at the state level for each individual state, and they can come up with criteria for things like enrolling to become a Medicaid provider, and the oversight through surveys, inspections, and those type of things can be done at the state level. So Medicaid is a more fractured program because every state has different requirements to become a Medicaid provider, but the eligibility requirements for Medicaid are based on income level. So there is a component for any person who is wanting to become covered by Medicaid. They need to meet certain income and asset requirements, meaning that the individual needs to make less than a certain threshold, and also less in terms of the number of assets. If there are too many assets or too much income, the individual cannot be qualified under a particular waiver program. And that's the second component. So there are waiver programs that are targeted at individual populations. So whereas Medicare is for everybody 65 years of age and older, Medicaid has different programs based on, are you a senior over 60 or 65 years of age or older? Do you have a developmental disability, an intellectual disability? Do you have traumatic brain injury? Are you a pediatric under the age of 18? They have numerous different individual waiver programs that have different requirements. And inside of those waiver programs, there are also income and asset requirements as well. So you have to qualify based on whether you fit in the waiver, like a pediatric waiver, whether you are under the age of 18 years of age and you need nursing home level care, and you make less than a certain amount of money and you have a certain number of assets. So that's how Medicaid is set up. And when a home care agency enrolls in Medicaid, then they have access to clients that need non-medical home care services in particular waiver programs. So the home care agency has to decide, what waiver programs do we want to be a part of? Is it for seniors, disabilities, for traumatic brain injury, or other waiver program to be a part of? But Medicaid does reimburse for non-medical home care, for home health, and for hospice services in certain situations. So Medicaid is much more utilized by our clients who are non-medical home care agencies that are looking to provide additional services. But it's much more nuanced when it comes to Medicaid. So the agency needs to spend typically a great deal of time, unless you partner with a company like ours, to understand how the state is set up, what the reimbursement, what the waiver programs are, what the reimbursement amount is for particular waiver programs. And even inside of a waiver program, there are different reimbursement amounts, like particularly for like home care versus personal care services, they get reimbursed sometimes at a different rate. So there's a lot more nuance to be understood for the Medicaid component for a home care agency. And understanding that and getting signed up correctly for the right program is really important, because you want to have access to the right Medicaid participants at the right reimbursement level to be able to support your agency and be able to function as an agency. So that helps to just provide a general overview for Medicare and Medicaid, how the clients that we support, which are non-medical home care, home health, and hospice, how they interact with Medicare and Medicaid, what's available under these payer sources, because they are critical and important payer sources in the healthcare space. If you're looking for a qualified professional or company to help advise you on which of these programs make sense for your agency, getting enrolled in these programs and understanding the different nuances, then reach out to us here at the Business of Senior Care, and we'll be happy to have an initial discussion based on what your needs are. And if it makes sense, we can move forward to assist you with the enrollment and credentialing.